If your doctor has said that you have prostate cancer based on your biopsy, what happens next? Well, then they will consider ordering some additional tests. They're called staging tests. The purpose is to find out where the cancer is located, because that will greatly influence the type of treatment that you can have. So what tests do we have available? The most common one is called the bone scan. A liquid is injected into your vein, which circulates throughout the bones, and it stays in areas that are abnormal. Now, the problem with the bone scan is it's not a perfect test, meaning that there can be false negatives and false positives. False positives mean that the scan looks abnormal, but it's not caused by prostate cancer spreading into the bones. Other things that are not cancer can cause the same effect. And if that happens, doctors will need to do additional studies to find out why the bone scan is abnormal. We used to do the bone scan on almost every patient who had a diagnosis of prostate cancer. But because of the PSA test, that's much less often necessary. Now, most doctors won't do it unless the PSA is at least 10 or even at least 20 nanograms per ml. And so that allows most men to avoid getting a test that won't really help them. In fact, doing the test on everyone could result in a lot of unnecessary procedures. Now, in addition to the bone scan as an option, there is also the CAT scan and the MRI. Both of them are aimed at looking at the pelvis, to the area of the prostate, the area surrounding the prostate, and also the pelvic lymph nodes, to see whether or not cancer could have spread into any of those organs. The problem with both of these tests is there also are a lot of false negative and false positive tests. Most men who have cancer growing outside the prostate have such a small amount that these scans are not able to accurately detect it. Nevertheless, if a man is going to consider having radiation, one of them will be ordered because it's useful for planning the treatment. Does everyone need a CAT scan or an MRI in order to plan their treatment? And the answer is no. It might be helpful, but it might also give information that can be misleading and doesn't necessarily help choose the best therapy. They are available, and doctors differ in their opinion whether they should be done. The last test is to do an ultrasound using certain materials that may help see if cancer cells are growing outside the prostate. That test is used by some doctors, but here too, it's not very accurate, and it's very dependent on the person who interprets the scan. So for most men diagnosed with prostate cancer these days, none of these tests are ordered on a routine basis. The problem is that they have these inaccuracies. And in the end, the decision is really made based on the physical exam and the PSA, realizing that they too also are not perfect for telling where all the cancer is located.